Hi, everybody. I'm Dr. Isaac Halliday, owner of Lodestar Physical Therapy. I am here with Dr. Kristina Hansen. She is the owner of Uplift Pelvic Health and Wellness in Mill Creek, Utah. Was the 2025 Best of Utah Mind and Body winner for pelvic floor therapy. She has a team boasting of over 40 years of combined experience. And Dr. Hansen and her Uplift team help people solve issues that no one wants to talk about pain, pee, poop, and sex. So, through a holistic root cause care that patients can get to living back without fear. So, welcome, Dr. Christina Hansen.
Thank you,
And
Dr. Hansen. I'm so excited to be here
so
and chatting with
awesome.
you today.
So glad to have you. I know we've kind of texted back and forth and chatted on the phone a little bit, but it's finally like we got you. So, um, welcome on and tell everyone a little bit about yourself. You are a physical therapist, but you just do different things than I do. And
Exactly.
it's awesome.
Exactly. So
Yeah.
think of it, if we go back to like cellular biology, we came out as undifferentiated cells as physical therapists, and then we went on and differentiated. Um, so I've been a PT for 20 years, and in that journey, I have done a lot of things. And I would say I was a Jackie of all trades until about 9 years ago when I had my call to action and dove into pelvic health and found what felt like my purpose, my calling. And at one point in my life, I was like, when am I ever going to find it? And pelvic health was absolutely it. And along that journey, in addition to pelvic health, I also support those with dysautonomia. And so that very much goes along with Ehlers-Danlos. I came from the neuro world, so love looking at the interplay and interconnections of nervous system, the orthopedics of the body, and the pelvic floor is very much a blend of that because so much of the pelvic floor is connected to the autonomic nervous system. So the things that our body does without us thinking about them.
That's awesome. Yeah. I I appreciate you so much and what you do because some people will ask me what do I do about this? And I'm like, that's not my department.
There
Like,
is
what
no,
about the pelvic floor? Or like
and there
leaking
exactly
when they lift? And I'm like, go
exactly,
somewhere
and
else.
that's exactly who comes to us,
Oh,
and people are like, "I'm not sure this is a really embarrassing question, or is this too much?" Literally nothing is off the table to the
yeah.
point where if you have a conversation with me, I don't know what normal conversations are anymore because it's all good for me. Like, just bring it. Let's talk about it. Let's normalize it. Let's help solve it. And I think creating a safe space for people to share those things that they might not even tell their intimate partners can
Mhm.
be really profound and really impactful on their quality of life.
Oh, 100%. And I don't know, it's nice to just have a place where you're like, hey, I can just talk about things. No one's going to judge me. And and you can get to the answers that no one's getting to because they're just afraid to talk about things, right?
Absolutely.
Like we all have a pelvic floor.
Thank you. We
Like
all
we
have
all
a
have
pelvic
one.
floor.
So talk about
Exactly. Exactly.
it. That's awesome. Cool. 20 years of experience. I thought my coming up onto 11 was like I say that and now I'm like, oh, I'm just a little baby.
Yep, and that's about the time I started and pivoted to pelvic health or
That's cool.
added into my repertoire of things, right? Like everything becomes additive and your toolbox just gets bigger, wider, and stronger.
Yeah, it does. Yep. That's awesome. How many PTs do you got there now?
So there are three of us total, myself, and
Oh,
then I have two colleagues that I am fortunate enough to have on my team, and they're amazing and absolutely incredible. So it gives us a really well-rounded opportunity to serve an even broader amount of people in our community, which is great.
that's cool. And just tell me a little bit about, or tell everyone about what pelvic floor therapy is, because I think a lot of people just don't know, right?
Yeah.
They hear pelvic floor, they hear, oh, Kegel, I do those, or right, but
Yeah.
Kegels
Yeah.
aren't the answer most of the time.
It's actually very interesting that you say this because I think pelvic floor physical therapy and occupational therapy
Mhm.
has been very popularized in social
Yeah.
media. And so it's given us a bigger platform. And I think our industry is growing faster than maybe other areas of physical therapy. And with that, there are more opportunities for people to segue in a way that feels authentic for them to make a living. And with that, pelvic floor therapy is at a little bit of a crossroads. So, pelvic floor therapy, if we just stick to what it is from a APTA standpoint,
Yeah.
so evidence-based for the last 40 years,
Yeah.
it is looking at the neuromuscular, muscular connections of the pelvic floor. So actually, let's just get out my pelvis. So
Yeah.
if we're talking about the pelvis, we have our spine. The bottom of our spine comes down here, then it turns into the sacrum and then our tailbone. Then we have our pelvis, which is two halves, connects in the front at our pubic bone. So our pelvic floor, the bottom of our pubic bone, starts all of the muscles of our pelvis. And actually, some of our hip muscles dive into the pelvic floor. And you probably can't see this very well, but here's an example of one that's cut. And it comes in and it literally attaches to the pelvic floor. The only thing separating one of your deep hip rotators from your pelvic floor is a ligament. So what's going on with the hip very much influences the pelvic floor. And then you can see the base of our spine, our tailbone, has connections into the pelvic floor. So our spine and our hip are intimately connected with what our pelvic floor is doing. When we say, when you go to pelvic floor therapy, typically that's going to involve an internal examination. I think there are therapists that have been informed of the pelvic floor, but they're not doing an internal examination. And I think to truly know what's going on with the pelvic floor, you need to know what the muscles are doing. You need to
Mhm.
visualize the skin health and what's going on with the tissue. So we get extensive training on the dermatology to the point where I was like, I'm getting 12 hours of training in one course before I even went to the course on dermatology. And I was like, why am I getting this? And
Huh.
it's like, oh, because we're the ones actually look at these structures. And
Yeah.
that can be very linked to what's going on with the dysfunction within the tissue or their symptoms.
Mm.
So pelvic floor therapists are those that will do internal examinations. Now, of course, if there's a person that is not open to that, it's not safe for them,
Yeah.
there's trauma, there's lots of things that are going on. We still have the skills and the tools to understand very intimately the nervous system connection, the neural connection, the muscular connection, its bony attachments, all of that.
Yeah.
So pelvic floor therapy, I like to think of the pelvis and the pelvic floor as the center of the system being the body. And so the pelvic floor has a lot of functions, much more complex than, say, our bicep or tricep or our quad. Fun fact, at least according to the world, according to Kristina and her pelvic floor brain, our internal anal sphincter is so smart. It has a receptor in there that can discern. You have a muscle that can tell whether you have solid, liquid, or gas, which is why, for the most part, when you fart, and when you poop, and
Yeah.
whatever else that way. So, which is amazing to me. It's like very mind-boggling how complex and how interesting the pelvic floor is. But when you come to our clinic, we're not just looking at the pelvic floor. You may be walking in the door with a pelvic floor symptom and think of that as like the end organ, right? Like if your knee hurts, you're going to treat the knee. But if
Mhm.
we were looking at the ankle and the hip and all of its interplay, we would be not looking at the whole system. So the pelvic floor often is like what's the link connected to the whole body and what's the reason for that symptom? For example, leaking. There's different types of leaking of urine. It's a symptom, it's not a diagnosis. So we need to understand, why is this body having this symptom and what can we do to solve that problem?
Hmm. Yeah. It's a whole that's a whole different ballgame.
Right. Yep. Yep.
Yeah,
So I don't know that I answered it well
it's
enough without being too controversial, but social media
100. No,
has
I
gotten a
love
hold
it.
of these
I
things
love
lately.
it. Yeah. No, I'm like, just keep going. Just keep going. I'm like, I'm learning cool things.
Awesome.
Because yeah, anytime someone like mentions like, I think it's my pelvic floor, I'm like, well, don't talk to me about it because I don't know anything about it. So like I'm not that dude.
Yeah.
So that's fascinating. And so like by doing like the internal exam and stuff, like what are you like feeling for? What are you looking for? Like what is it?
I know, right? And so, I mean,
Like, yeah.
let me try and simplify it as much as I can because like I have so many things that I could potentially say. We're looking for skin integrity. We're looking for reflexive activity. We're looking for, does the breath connect? How are the core and the pelvic floor working together? How are the hip and the pelvic floor? How is spinal motion and the pelvic floor? And then specifically, what are the muscles doing, right? Are the
Mhm.
muscles contracting the same front, back, side to side? Are they relaxing as well as they're contracting? It's a lot easier to know if your bicep bends and straightens because you can see what's happening at
Yeah.
the hand. But with your pelvic floor, and especially when you say, well, is pelvic floor therapy just Kegels? If pelvic floor therapy was just Kegels, we wouldn't exist as a profession, right?
Yeah.
Um, But what happens when they contract and does it let go? And how does it contract? Because there are 3 layers of muscles over 14 muscles here. And so some people are over contracting the front, but you can peel it off. And then there are all these deeper muscles. What's doing what? And some of them are autonomic, meaning the nervous
Yeah.
system, part of your body that does things without us thinking, heart rate, respiration, breathing, digestion. Same thing with the pelvic floor. If there's a stress response or we get stuck in a more upregulated fight or flight type part of our nervous system, and that can also include fawn, freezing, the things that aren't
Mhm.
parasympathetic, which is our rest and digest,
Yeah.
that can heavily influence the pelvic floor. Just like you'll have somebody that comes in and they're like, oh my gosh, I'm so stressed. I feel it all in my neck,
Hmm.
my jaw, or headaches. And some people, I think there's even a book that's like the headache in the pelvis, right? So it's where is the nervous system having a response to stress and how are they storing it or not storing it? But typically when I see patients, it's storing it in the pelvic floor or
Yeah.
the pelvic floor is responding to that stress that
Yeah.
way.
Interesting. What are like typical like this is like a loaded question. Like I know there's going to be like 1,000 answers. But like what are like your typical patient that's like, oh, this is I don't know, how do I word the question? Um uh I don't know how to word that question. I just lost it. But like the typical reasons why someone would come see you, like car accident, or is it like lifting issues? Like, they're lifting weights, or like maybe they just I don't know, what are the like most common things that you see that they're like, oh, this is affecting the pelvic floor
Well,
most.
and I think, right. And that's such a good question, because it's yes, all.
Yeah.
So you see pro athletes, and that can be cyclists, that could be triathletes, that could be soccer players, your endurance athletes, your rock climb. I mean, literally any athlete. And it can also be, it doesn't have to be a pro athlete, it could be the everyday athlete, the person who just likes to stay physically active. It could also be somebody who's maybe never exercised in their life. In terms of why they're coming in, it is typically going to be, and it varies. I mean,
Mm.
it's
Yeah.
all over the board. I would say if you pee, pooping, sex, pain problems. And so it could, and I don't know how much I can say if this goes out onto social media, but um, either, so there's something called PGAD, pudendal, or like persistent genital arousal disorder. There can also be anorgasmia. They've never had an orgasm or they can't orgasm. There can be pain with erection. There can be inability to have an erection, right?
Hmm.
So, like erectile dysfunction, we can have all sorts of constipation issues or fecal incontinence issues or
Yeah.
just impaired mechanics, not pooping the way you want to, anything related to peeing, anything related to either like there's different types of pain with sex. So it could be vaginismus, a spasming of the pelvic floor muscles where they can't even relax. There can be dyspareunia, which is more of a global term. And then there are specific structures of the pelvic floor, something, and I'm doing this as though you know what tissue,
Yeah.
but on the back part of the pelvic floor, the vaginal opening, for example, this tissue is actually different than the vaginal tissue and different than the rest of the vulvar tissue. It's called the vestibule. And so you can get something called vestibulitis, which is why doing an exam can give us that discernment of what's specifically going on for those tissues. And if you've ever had, say, a history of STD or a history of urinary tract infections, there's also bladder issues that can happen, like interstitial cystitis or painful bladder syndrome is another thing that it will be called. We now know from the evidence the number one grade A thing you can do for interstitial cystitis is pelvic floor PT. Less than 2 or 3% of people actually have lesions on their bladder. Is typically something related to the pelvic floor and connection to the nervous system. 3/4 or 75% of the nerves that innervate the bladder are autonomic nerves. So again, what's
Yeah.
going on with the nervous system? So I dare say the nervous
Mhm.
system is queen. And if so yes, we're looking at the pelvic floor, but we're also looking at the nervous system and how it responds to things,
Yeah. Yeah.
also management strategy. So I don't know if I
Yeah.
answered your question, but
No,
it's
it's
a
a lot. Yeah.
literally it could be anybody. It could be an adolescent, it could be a young adult, it could
Hmm.
be an older adult, middle-aged, senior citizen.
Yeah.
Like pelvic floor dysfunction does not discriminate.
Yeah. Yeah. And I like how in there you also said like it's most of the time it's an autonomic problem, right? To where like
There's a
which
very
means
strong
which
connection
means
to that.
you don't have control over it. It's not something that just you're voluntarily doing it, right? It's just autonomic. It just happens. It's automatic. So,
So you think,
um,
what is the lifestyle you're living and how stressed are
yeah.
you? What is your trauma response to things? What historical traumas have you had? And maybe that's present day. You were in an auto accident. You witnessed something really terrifying. It could be your home life. I mean, it could be how does your body respond to whatever you're experiencing?
Yeah. And right, so if someone's like listening and they're like, well, let's if it's an automatic response, how does pelvic floor help something that's automatic, right? That you don't have control over? How do you do that? How do
Exactly.
you
So
treat an
that's
automatic thing?
right, right. So that's why it's so important to come in and speak to somebody who is an expert in this area and figure out what is the driver for that person or what are the drivers,
Mhm.
and then come up with strategies. There's a lot of education in what we do, right? I mean, that's for all physical therapists, but it's very heavy in education, lifestyle management, in addition to manual therapy and exercise
Yeah.
prescription, right? Like we have lots of different tools to pull from, depending on what's the root cause for that person, which is why there's a cookie cutter prescription that we're giving every single person. And there are some people that works well for a period of time, but we also want to give people as many tools and as much information so they understand their body. And if and when it comes back again, or they experience something down the road, they go, oh, I know this. I understand this. I mean, I'm to a point where now I have patients that are like, hey, I think I can tell you it's my obturator internus. And I think it's because I glute clench from when I was a ballerina. And I was like, wow,
Yeah.
because I want to give that information to somebody so they understand their body so that they,
Mhm.
I mean, it's definitely like a mind body connection. Like I really want people to feel and connect and understand their body. And that's not comfortable for everybody. So
Right.
obviously we're going to meet people where they're at. And there's a whole scope of how do we meet the person in front of us
Yeah.
or
Yeah.
what they want, what they need.
And what their goals are, what
Yep.
all of that stuff. It's like,
Yep.
yeah. Yeah, I see that a lot too, like in my patients who we're like we're not pelvic floor, we're kind of a general orthopedic, but some people have goals to go run a 150-mile race, and some like I just want to be able to go to work.
Exactly, right?
Totally different end games, different treatment models, and everything, right?
Absolutely. And I've had some people that are like the second person, right? I just want to be able to go to work, or I
Hmm.
just want to be able to pick up my kids and run at the park. And then they can do that. And they're like, well, and now I want to run a 5K or a 10K or a half marathon. Like I didn't know it could even be
Yeah,
this good.
yeah, totally. Yep, happens all the time, right? It's just like they realize you're like, wait a minute, this is what a normal life is.
Yeah.
I want to do more, right? And it's like
Uh-huh.
that's like the fun part, right, of our job.
Absolutely. We're
Is
we're
when you,
very lucky with what we get to do and how we get to serve our community and the
yeah,
problems we get to solve.
yeah,
It's a privilege all day long. I feel
yeah,
like there are so many days where I'm like, I want to write a love letter to all of my patients that I feel so fortunate that
yeah.
I get to help and serve them and see the wins that they get to have. It is incredible.
It's cool. Yeah. So then, how do you, as a pelvic floor specialist, differentiate between like, oh, this is a hip problem, or this is a pelvic floor problem, or this is a combination problem, or maybe it's like low back, pelvic. How do you like just say, hey, these are the key indicators of like could be a pelvic floor or it's probably just like in the hip.
Most of the time when patients come to me,
Yeah.
it's usually a yes and. It's usually not just a one thing.
Right. Right.
Sometimes it's all the way down to the foot mechanics. Like I literally just worked with somebody who has lumbar radiculopathy, but started out with a pelvic floor complaint. And we've now come to, as we get into the assessments, go, oh, it's the ankle sprains that you had when you were an athlete in high school that then developed these compensatory problems up the chain. And so it's a yes and
Yeah.
typically.
Yeah. So if you were like for me, if I were had a patient and what should I be listening to be like, oh, you need to go see Dr.
Yeah. Oh,
Hansen.
that's a great question. Um, I guess if it's going to be a person that has like low back pain or hip pain and it's not getting better pretty quickly, you're not seeing the typical progress. And
Mhm.
then maybe they are on your table and they're like, excuse me, I need to go to the bathroom. Or they start to mention they're having issues with either urination or bowel movements, or they start talking about issues with intimacy. So I would say failure to progress at a typical rate, or those other symptoms.
Okay, yeah. And not just I get a lot of patients in the morning that like they always come in and go right to the bathroom. They're like, hold on, morning coffee.
I mean, that's
I'm like,
fair.
oh, fair.
That's fair. I'm that person too with morning coffee. I mean, coffee. I love my coffee. I love coffee. So I'm not going to say anything negative about coffee, but it is a bladder irritant. It is also a diuretic. So it's
Yeah.
two reasons that can make you pee more, but it also helps stimulate bowel movement. So it's like it hits all of them.
It gets things moving.
Yeah, yeah, yeah. But if you've ever had somebody on the table and they're going to the bathroom a
Yeah.
couple of times within an hour, that's definitely something going on,
Mhm.
because really normal voids are two
Mhm.
to 4 hours in a day. And I think it's
Yeah.
important to distinguish not more than that also,
Yeah.
because you could be going too often, but then we also have the category of like nurses, school teachers,
Mhm.
surgeons, and other professions where they literally cannot go to the bathroom. And
Yeah.
then they create other issues with their bladder from holding it too long.
Yeah. Yeah. That's awesome. So, like, I pride myself on how long I can hold it on a road trip.
I mean, a road trip is fun, right? There's always going to
I'm
be
like, no, I'm
exceptions to
not
the rule.
stopping. I just filled up. I'm not stopping.
Uh-huh. I have made it to St. George without going at all.
Oh yeah.
But now I have an electric car, so I have to stop, which is totally fine.
I love it. Yeah, all my friends, every time I do a road trip, they're like, Isaac, we need a bathroom break. I'm like, no, no, I got three-quarters of the tank. We got 350 more miles to go. And they're like, let me out. It's like, fine, I guess we'll stop. That's awesome. Uh, yeah, I don't know, what have we talked about all the misconceptions I think that are out there? Um, I think
I
there's a
think so.
lot with it because like,
Okay, so I think misconceptions is pelvic floor therapy is just looking at the pelvic floor. I
yeah.
think misconceptions are Kegels are the solution for everybody. Um, or
Yeah.
the pelvic floor therapy doesn't work.
Mm.
And unfortunately, it is a little bit of the wild, wild west. You can go to a weekend course and hang your hat and say, I'm a pelvic floor therapist now. If you take a level one course, that gives you permission to be in the room. It's just, it almost is its own sub industry, and it
Yeah.
needs the reverence and the training that correspond with that.
Yeah. Yeah. Totally. Um, that and it's not just for pre and postpartum,
It's not
right?
just for pre and postpartum. It's also not just for women.
Yeah. No, that's yeah. That was on my ticket, like men too. And you
Men
treat
too.
both, right?
Yep. Yep.
Yeah.
Absolutely.
hmm Love it. Love it. Um, yeah, in fact, I think I have a friend in Tennessee who does pelvic floor. And she's like, yeah, she's like, we see like it's almost she's like the men that like come in, she's like, it's growing exponentially, like the amount of
It, it
men that
is, and
are
it's
coming in.
wonderful.
Yeah.
It's like the word has gotten out in the last couple of years, and men are going, oh, I don't have to live with this either. Like
hmm
I think a lot of it's normalized. I mean, there's even research particular to women with leakage that it takes an average of about 6.5 years before they even seek care for that issue.
Yeah.
So, and I don't know if the data is on men, but we're definitely seeing
Yeah.
a pivot, and they're getting finally the care they need. And I would say if
hmm
I think women are underserved in this industry, men are more underserved.
Yeah.
So, but yeah,
Yeah.
definitely seeing more, which is
Yeah.
wonderful.
Yeah. What about like speaking about men and pelvic floor? Like, what about like prostate cancer and then like they don't have the prostate? Is that something that pelvic floor therapy works
Absolutely,
with? Yeah.
absolutely, absolutely, because oftentimes there are consequences after having the surgery, whether
hmm
they had radiation with it or
Yeah.
without it. And so learning to recoordinate those muscles and get pressure management and all of the things, and also just help with any of the scar tissue. And that tissue can tend to be pretty friable after radiation. So
hmm
absolutely,
Yeah.
I love it when we can help that population.
That's cool. That's awesome. Man, this has been I'm learning so much. I love it. This is so cool. Is there anything anything you want to totally bring out that we haven't talked about so far? Did we miss anything exciting? I think we got it all
We
that
might
we
have got.
had planned anyway, I guess.
No, I was just gonna.
Um,
Let's
but
see. I mean, I think just to reiterate
mhm,
that pelvic health is a whole body type of therapy. The pelvic floor works as part of a system. Muscularly, it works because it's supporting your organs, it's providing stability to your pelvis. From a neural standpoint, 70% of the nerve fibers that innervate the pelvic floor are autonomic in nature. So we need to know what the nervous system is doing. Also, we need to be thinking, well, if the pelvic floor is the base of the whole torso, what's going on with the respiratory diaphragm? What's going on with the whole rib cage thoracic spine? But also, what's going all the way down to the foot? So we know that if we're missing great toe extension, if we have less than 45 degrees, that 3x's the ground reaction force is going up through the whole kinematic chain. Basically, a fancy way of saying if your big toe doesn't move well, it's going to hurt your joints. It's going to make it a lot harder for your pelvic floor to function. So we need good pressure management and we need good motion through our body. We can go on about the hips, we can go on about the T-spine, all of those things, but that's
yeah,
why pelvic floor therapy is, for me personally, is so fun because it is so all encompassing and you do get to zoom out. You get to zoom
yeah.
in, you get to zoom out, and you get to keep playing with it, which is really awesome. And then people get lit up when they go, oh, that's why. I
Mhm.
had a patient who um, had an abdominal surgery and had a scar. And from that scar, ended up having a hamstring tear, and they never linked the two of those things together. And the pelvis kept pulling forward, which overstretched the hamstring. And then when she was rock climbing, she tore her hamstring. And finally, we put all the pieces together because we needed to look at the skull and the abdomen.
Yeah. Wow. Yeah, that's fun.
Right?
That's fascinating. Yeah. Yeah,
And I
that's so
and I
cool.
and I think that's part of why I started
Mhm.
this practice. I mean, the reason I started this practice was because I realized I was a travel PT for a few years. I've worked at a lot of
Yep.
places in our area, and most companies somewhere in their mission is patient-centered care, patient comes first. And it was like an unveiling of actually, health insurance comes first, corporation comes second, patient comes third, the provider comes fourth.
Yep. Yep.
And I wanted more for myself, but I wanted more for my patients. I
Yeah.
really want to solve their problem. And I'm tired of insurance saying, no, you're a knee, you're a hip, you're an ankle.
Hmm.
No, you're an entire human being.
Yep.
And I want every person to feel seen, heard, and valued.
I love it. How can somebody come to you and be seen, heard, and valued?
Yeah, so if you want to come work with our team, you can look us up online, Google Uplift Pelvic Health and Wellness. We're in Mill Creek, Utah, right on Highland Drive. And you can also call us. Our phone number is 435-465-0657. You can also look up our website, which is upliftphw.com for pelvic health and wellness.
Awesome. Very cool. It's been so fun chatting with you.
Oh my
It's been
gosh,
so fun.
it's so fun getting to chat with
Yeah,
you. I feel like we could chat all day long. Thank you
we
so
probably
much for
could.
this
Yeah.
opportunity to connect with you. I really appreciate it. It'd be fun to do the same in reverse now.
Hey, let's do it.
Okay, perfect.
Okay. Awesome.
Part two.
Yeah. Hey, I'll chat with you later.
Okay, thank you,
Okay.
Isaac.
Bye.